With more COVID patients in hospitals and near record numbers in ICUs, the warnings from healthcare officials are dire.
Our health system is on the brink of being overwhelmed.
Today, Premier Brian Pallister directly asked the Prime Minister to take the pressure off by sending in 50 nurses, 20 respiratory therapists, and 50 contact tracers. Manitoba doctors say it's about time.
You know, at the end of the day, when we're in a crisis, asking for help is not a sign of weakness. It's a sign of strength. I'm comforted to know that help has been sought from other provinces, but it should have been done sooner.
It's a point the mayor of Winnipeg made publicly today.
I'm disappointed that once again in the third wave, we're in a position where the provincial government is reacting to higher case counts instead of taking the proactive measures weeks ago that I and others, including doctors, had been calling for.
The federal government promised Manitoba a swift response.
I know the Public Health Agency is looking right now across the Government of Canada as to how quickly we can bring together these personnel.
It's unclear where the personnel would come from. The Canadian Armed Forces are one option. The Union for Respiratory Therapists questions if there are any to spare.
Are we in a situation now where we're making announcements and making announcements like this to make it appear that we're finally doing something?
The situation is urgent. The province has transferred more stable ICU patients to Ontario and may send even more to Saskatchewan and North Dakota. Premier Brian Pallister described this week as the darkest days of the pandemic, but they may still be coming. Provincial modeling projects the number of COVID patients in Manitoba ICUs could continue to rise into June. Bartley Kivas, CBC News, Winnipeg.